All right, hello everybody, and welcome to another installment of Ask the Experts. I'm your journalist, Zach Pottle. Today I'm joined by Dr. Leonard Lado. He's the medical director for the Willows at Naples Psychiatric Hospital and the founder of the Lado Healing Institute. Dr. Lado, thank you so much for joining me today.
Thank you for the privilege and opportunity to share this
Great,
information
yeah,
with
it's a
you.
pleasure.
Okay.
So I'd like to spend a little bit of time today talking about the opioid crisis here in America. And I understand that you do a lot of work surrounding opioid addiction at the Willows at Naples. Could you tell me a little bit about what you do there and specifically how it applies to opioid addiction?
Yeah, I've been doing addictions for almost 25 years. It turns out that when I was practicing in Indiana, when the medication OxyContin came out, nobody knew there was be developing into an epidemic. In the Midwest area in Evansville, Indiana, I used to be medical director there, and we were getting people with pain problems. It was there back in it was 1995 when it appeared to be a problem. People were coming to the Midwest to get OxyContins. We had no clue what was the purpose. So the question has always been, why such an addiction to such a drug, right? And then because the addiction is extremely diverse. It's not only you would expect the population to be uh, uh, the the type that you imagine in the movies, but it really isn't. Addiction seems to be broad spread from children all the way up to the adults and geriatrics. So the big question, why is this such an epidemic?
Yeah.
Well, so basically, the answer at the beginning I thought it would be rather complex, but it really isn't. Assuming you have pain, let's say suddenly you have pain, you have an injury, and basically you were given this medicine, and suddenly not only your pain was alleviated, but suddenly your anxiety and your mood and your focus. And then suddenly you realize, well, this is not just good for pain, but it's helping me with these other
Mhm.
issues. And where do these issues come from? It appears that we have been pervasively affected by conditions that we never treated. I think that many of these people that have become addicted have underlying problems that were never treated, such as anxiety, attention deficit, and depression. I also do clinical trials, by the way. In fact, I am doing now a clinical trial on opioid addiction on a new drug that's
Okay.
coming. Right? I've been doing clinical trials for almost 18 years, and I'm in the forefront of what's coming and the concerns that many of the people, the needs for the population, and this continues to appear. So the problem is that it appears that opioids not only have anti-pain properties, but it also has properties for attention, anxiety, and depression. But the problem is that these drugs are not designed for that. And once you taste it, it is very difficult to come off. And that appears to be my answer to that they can't figure out. It's very simple. And this is why it is very pervasive.
Yeah. So you mentioned that the idea of who it is that can become addicted to opioids, and I think we as a society, non-medical, the non-medical society, we often think about drug addiction as being this back alley lucrative means of obtaining a drug, and when in fact for opioids that's just not the case, correct?
Correct. Absolutely. The ones that you see in the back alley, it's heroin. And let me tell you, people with chronic pain are very
Hmm.
desperate. I have seen people who come from a good home, they're desperate with pain, and they actually take the chance of using heroin. And the thing is that heroin is not only used IV anymore, you can
Hmm.
snort it, and it's mixed with other compounds. So it is not what you imagine. We're talking about, and you know what's interesting is that I've seen cases where the grandparent has a chronic pain, and the adolescent curiously discovers it and they
Hmm.
use it. So it is not what you imagine. And the problem is that when you tell somebody you're an addict, you
Yeah.
stigmatize them. And when you stigmatize them, you begin to realize, oh, there's something wrong with them. The truth is, you have to take care of the foundation of the problem. I think that a lot of people I treat with now, fortunately, there are treatments that you're probably going to ask me later for this, but as soon as you treat them, you also begin to discover that they have anxiety
Hmm.
disorder, they have mood disorders, and they have attention problems, something they have lived with since they were young, but they never had a solution. And it's interesting, there are compounds being developed right now on the premise of this compound, opioids. Um, there's new products that are being tried out for this as a result of this addiction. So the issue is that do not be
Yeah.
stigmatized. It's just something that you can get help because you're not alone in this
Yeah.
problem. Yeah.
So just to cover real quick, because we had mentioned the difference between that back alley and the the opioids that we're talking about now, but I think it's important to note that the heroin is an opioid, correct? And so,
Correct. A very
yeah, and
powerful one.
so when we talk about the opioid crisis currently in America, are we talking about heroin or are we talking about a different kind of opioid?
No, no, we're talking about
Okay.
painkillers, oxycodone, roxycodone, and the most recent one that you're seeing now is
Hmm.
fentanyl and Dilaudid. So what happens is with these drugs, as any drugs of addiction, you develop what we call a tolerance. And the tolerance means that you have to use a higher amount to achieve the same benefit. But the problem is that if you push these drugs to the limit, your brainstem can only handle a certain level. And this is why people are dying, because the effect of the euphoria requires much more than your brainstem can handle. And what complicates this matter is that people are doing this not knowing that other medical conditions can provoke death. Like, for example, assume you have what we call bronchitis or you have a lung disease. Well, your respiratory situation is already compromised, right? So if you start using this drug and then you mix them with other medications, if you mix these medications with high doses of what we call gabapentin, you stop breathing. And then because you have withdrawals from the painkiller, then you start using benzos like Xanax and Valium. And then you definitely have a very potent combination, which is very lethal. So it's not just heroin, it's other stuff. And then you probably haven't heard about this. This is the product we call kratom, which is another drug. Have you
I've
heard of
not, no.
kratom? Oh, kratom you can buy in a store. Kratom is a goes on the premise as an analog of an opioid. And now this is something you're not aware of because we see at the hospital, you have people overusing kratom. Look it up. Go to a gas station and ask for kratom.
Interesting.
But they use it excessively to the point that they become extremely psychotic and they wind up with hallucinations. The problem is we don't have the ability to be still and tolerate emotional pain. And the crisis has become worse with what we know already, and you probably will discuss, is the pandemic.
Yes, yeah.
Anything to escape emotional pain and loss. It is unfortunate, but we as a society have not been able to develop skills in saying it's okay to fail. It's okay to lose. You know, loss is like you being in a precipice of an edge of a place, of a
Hmm.
mountain. And it's an opportunity for change. We cannot even go to that precipice. It's too hard. So we discover the effects of painkillers. Just very much like the 20s, the hashish, what we call the opioid dens.
Yeah,
Remember? It's coming back in a different form.
yeah. It's so important, yeah. So is there anything in particular in your experience that you've noticed with opioids that makes them so addictive? I know you mentioned those, what we would call comorbidities. Um,
Yeah. So what makes them highly addictive is the rapidity that they reach your brain, right? So what makes any substance? What makes any substance addictive? Well, all these addictive substances impact a part of your brain which we call the dopamine system. Dopamine is the pleasure transmitter. This is the transmitter of love, the transmitter of sex, the transmitter of euphoria. So any compound that acts on the brainstem to elevate those levels of dopamine,
Mm-hmm.
right, is going
Mm-hmm.
to do this. Now, it appears that dopamine is not the only transmitter. It appears that we inside have receptors, natural receptors, we call endogenous opioids. How would you describe that? What's an endogenous opioid? Well, for those who are runners and for those who exercise, have you heard of the expression, if you're stressed out, exercise?
Is that the same
Yes.
kind of
When you push your,
is that the same
yeah,
kind of concept of like a runner's high? Is that what you're getting at, kind of? Okay.
correct. So what happens when you are a jogger or you are a athlete? Um, what happens to your body has these internal chemicals to help you adapt to the old fight or flight response, right? So in the old days, when you were in the jungle, you had two choices: you run or you fight. Either way, you need certain chemical support from your brain to survive the ordeal. We do it now in sports. We do it now in running. So what happened? You begin to reach a level where you have these substances that bring you calmness, tranquility, and pain. But they don't give you, it's called a runner's high. It's a different high. You have this incredible peace and tranquility after
Mm-hmm.
the run. However, that is done very, very slowly. With these drugs, they elevate these, they block these, they block these they activate these receptors, and they cause a series of chain reaction that it gives you an incredible euphoria. And this euphoria has not just a sense of well-being, but remember, this attacks all levels of your brain. If you were anxious, you feel calm, and if you have lack of focus, you're totally
Mm-hmm.
focused. And if you're very depressed, you feel happy. And the speed that this does it makes it very addictive. This is why Dilaudid, and this is why oxycodone is highly addictive. The chemical causes rapid changes in your brain, and at the same time, in the same way that it causes rapid changes, when it leaves the body, what happens? You get this
Mm-hmm.
crash. You don't want to feel that way anymore. So what do? Hey, when is the next pill? Right? And that's how these compounds make it so addictive.
That's so interesting because we think about side effects of drugs are all too common. You see a drug commercial and it's side effects may include X, Y, and Z, but usually there's a trade-off. If you're taking a heart medication that prevents heart attack, a side effect of a mild side effect is a good trade-off. But with opioids, it's seeming like there's less and less of this kind of trade-off if it's so highly addictive. Could you expand
Yes.
on that? Do you see a benefit to taking?
Okay, so here, for example, okay, so what's the trade-off? So interesting enough, one of the things that we now have in our arsenal is something we call
Okay.
buprenorphine. And buprenorphine is we call Suboxone or Subutex, which we call an opioid blocker. Okay, so here's a good example. So once we use this compound to get people off the opioids. In itself, you can label Suboxone an opioid, but it lacks one thing:
Okay.
euphoria. So the key component is the euphoria. However, it retains the other three properties: pain relief, it retains the property of focus, anxiety, and mood. So you say to yourself, hey, great, I just discovered something. Let's pop everybody with Suboxone, right? It doesn't work that way. Uh, I can tell you that the people who have come off the painkillers and we give them Suboxone, they can get high. You can go up to a certain level. However, the one without the blocking compound, which we call naloxone, which is the plain buprenorphine, has an addiction
Okay.
potential. This is why I don't encourage practitioners when you treat for addictions. to give that without the blocking agent. So, yes, if I answer your question correctly, I think I answered your question correctly in case I got sidetracked.
Yeah, yeah. And so you kind of touched on, because I would have just gone right into that question of, well, why not give everyone the Suboxone, right? If it's,
Okay.
but and you had mentioned that you can't give it to those who are trying to come off of the opioids because it won't give that high. Do you think the solution would be to, at the beginning, replace the original prescription
Okay.
with Suboxone?
No, what we use Suboxone as a way to take you off. So what happens when we have a person addicted
Mm.
to opioids? There's something we call Suboxone induction. You need a special license from the Drug Enforcement Agency, and you need training. I have done heroin detoxes in the
Mm-hmm.
office. Yes. Now you say that you could never do that years ago, but with Suboxone you can. So what is an induction? Okay. So an induction means that in order to remember, Suboxone is a compound that blocks the effect of the opioid. So if you block the effect of the opioid too rapidly, what happens to your body? You go into withdrawals, right? You go into shakes. You begin to sweat. You begin to have severe tremors. You begin to vomit. You begin to be profoundly sick, and your blood pressure goes high. So the process of taking somebody off an opioid with Suboxone is done gradually based on your vital signs. Methadone was a drug that was given, it's still
Mm-hmm.
given, and some people will swear by it, that if you have an addiction to opioids, let's give you methadone. You probably
A
heard about
little
methadone
bit familiar,
clinics.
yeah.
So the methadone clinic, the purpose of it is that to give people methadone so they don't use heroin. But there's a catch to that. Methadone also causes euphoria. So then you have somebody now addicted to methadone. I know there might be colleagues out there that might get a
Oh,
backlash on this, but I don't really subscribe to the methadone treatment. I think I have people that come to my office is take me off methadone. Methadone is harder to come off, but not impossible. So the drug is given to take you off, and then if the person has chronic
mm-hmm.
pain, right? You put them what we call on a maintenance program, meaning that instead of taking them off completely, you keep them on a dose of Suboxone between 4 to 24 milligrams, and they can be on it, and you're allowed to
Mm-hmm.
be on it for a long time, and it helps their pain, and usually it's a good substitute. So, but you're asking me why not give it to pain? That's something that's more complicated to answer. You have a lot of people who do pain management with a lot of complicated procedures. Okay, so that is not my
Yes.
department. Uh, in regards to people who don't suffer pain, and they can stay on it for a couple of months or 3 months, but you realize that they also have anxiety, so you start treating their anxiety with something else, you start treating their mood with something else, and you treat them. So by substituting the medication that they have problems with, they become less dependent on an
Okay.
opioid. I hope that answers the
It
question.
does, yeah. Um, Thank you. And so, switching gears a little bit, we had mentioned it, and I do really want to talk about it because it is very important. Um, is the COVID-19 pandemic? I mean, it has
Yes.
seemingly impacted every aspect of all of our lives, and I think a very vulnerable community at the beginning of the pandemic were people who were either
Yes.
struggling with an addiction, recovering from one, or who were on
Yes.
the precipice of one. Do you see that at the Willows?
Oh, yes. It
Yeah.
was big. And also, I have to tell you, um, I was also surprised with the pandemic, and I feel like I have to disclose this, that we were expecting to have a large influx of COVID positive patients. These people who use drugs, they're not very careful with social distancing, sharing needles. So the biggest concern that they would import, since our hospital treats a large population from around the country, we were expecting a large
Mm-hmm.
influx of COVID patients, which would impact the treatment. And I kept scratching my head. We didn't see that, and I don't have my fingers on it, and we don't have an answer for it. Uh, but it's in regards to impacting the opioid? Yes, it did. Now imagine. I mean, out of nowhere, you saw what the images were at the
Yeah.
beginning. The images originally came from China, people falling on the ground, right? And imagine what you heard in the media. We did not know what we were dealing with. And then suddenly, everything that you had was taken away from you, right? Your income, your schooling, everything that gave you a sense of ritual. We humans are ritualistic creatures. In the old days, we used to run around the fire. Hopefully, that good things continue, but I think we passed that already. But we have other rituals, right? The mall, the things that we
Yeah.
do. These, when those rituals get taken away, what happens to you emotionally? Fear, anxiety, depression, lack of hope. It wasn't just opioids. We're talking about alcohol and whatever people could get their hands on, but particularly opioids, what's much easier to access. And the crisis became worse. There was a lot of death. I don't have to show you the
Yeah.
statistics. You can Google that and you will see how many people died. Enough that the government had to intervene with action because people were dying. Yes, it did impact the opioid crisis. It not only did it impact, it introduced new people to
Yeah. That.
opioids. And then fentanyl became a valuable thing. The most dangerous opioid to use is fentanyl. Very dangerous. It kills you very quickly.
Yeah. You had mentioned those new people, and that was another area I wanted to go into. Do you, in your experience or things that you've seen, have you seen anything different about, I guess we can call them these pandemic era addictions, for lack of a better words? Is there anything different about people who may have become addicted during this extremely stressful past 2 years than normally?
There were people like you and me and everybody else, workers, right? They just discovered a new way to treat themselves with their pain. So we're not talking about people in the streets. We're talking about people in the home. Okay. Uh, so yeah, there was an increase in incidents. Well, the numbers are staggering. I mean, um, so it introduced people to a new way to self-medicate their sorrows.
That's, yeah, really sad. Um, really quickly before I want to don't want to run out of time. Um, for those who may think that they know someone who's struggling with an opioid addiction, who may be struggling with it themselves, what are some of those telltale signs of an opioid addiction, and what are some of the best ways that you can go about getting help now in this COVID era?
Embrace them, forgive them, don't judge them. They're in pain. You want to grab somebody for help? Don't judge. Biggest mistake. We're all the same. We all come from the same source. We all have the same fears, and we all have the same happiness. It tells you that that person is suffering. Embrace them. Be with them. The problem is they have to have one factor. Do they want change? And what does that change involve? Remind them they'll lose everything. Many of these people will lose their families. Many of these people will risk going to jail to buy the product, right? This is where they get caught. Many of these people often forget the people who love them, right? And you get so involved, right? You know, people tell me, what does evil look like? People have these images of evil like horns and some like darkness. Evil is very subtle. It is revenge, envy, anger, hatred, and addiction. Addiction steals your soul, my friend. It steals who you are. Ask anybody when they're addicted to substances. They look at themselves in the mirror and they say, I was not like this when I was a boy or a girl. They steal, they sell things that don't belong to them. So they struggle. So you embrace them, right? You embrace them. and you embrace them because they're needing somebody, and that's how you approach this. Now it gets to a point that they lose judgment and they can't listen. Sometimes people listen when they hit the floor, my friend, when they lost everything. But it's never too late. You got to give people hope. And you don't give them hope by labeling them and creating images on television, right? That makes them look horrible.
Yeah, exactly. Yeah. Thank you very much. Once again, for those of you that have been
Yeah.
watching or listening, uh, we've been talking to Dr. Leonard Lado. He's the medical director at the Willow at Naples Psychiatric Hospital and founder of the Lado Healing Institute. Dr. Lado, thank you once again for taking the time out of your day to speak with me. It's been a pleasure. I really appreciated it.
Thank you. I hope your audience
Yeah,
enjoys this.
thank
Thank
you.
you.